talking about PIH today. What's PIH? PIH is post-inflammatory hyperpigmentation, and it's something that happens after you've had a skin condition like acne or psoriasis or eczema, or after you may have had some trauma to the skin like a burn or even razor bumps. It can also happen when you've got specific medical conditions, autoimmune conditions or other inflammatory conditions like lichen planus, or after you've taken a course of medication, for example anti-malarial tablets or even some anti-cancer medications. So what is PIH? What does it mean? It basically means that the amount of pigment, melanin, that you produce becomes a little bit excessive. So your production of melanin is effectively slightly deranged because of these conditions or the inflammatory or traumatic episode that's happened to your skin. So your skin produces loads and loads more melanin than it normally would because of the inflammation or the trauma, and it transfers that melanin to the surrounding skin cells. So from the site of your acne, which you may have been picking, which causes more inflammation to happen, which causes more melanin production to happen, which causes more melanin to be transferred to surrounding skin cells, which means when you look in the mirror you end up with lots of dark spots where you used to have your actual acne spots. So what can you do to treat it or to manage it? Well, the first thing you can do is make sure that you're protecting that skin from damage from the sun, which can actually make areas of dark pigment even worse and look even darker. So wearing a broad spectrum SPF 30 at least, preferably SPF 50 every day is an absolute must, non-negotiable. There are treatments you can have in clinic, but you need to be careful that those treatments don't actually make the dark pigment worse. So you can have things like chemical peels, like glycolic acid peels, but you need to be careful that they're not too deep or too concentrated because they will trigger that inflammatory reaction in your skin and start that pigment producing cycle all over again. Other treatments that can also make things worse before they get better are things like microneedling, lasers. So you need to be careful that you're entrusting this type of treatment to experienced hands who understand how to make sure that the pigment doesn't get worse as a result of the treatment. There are lots of medications and creams that you can apply to the skin. Some of them on prescription, some of them available over the counter. So these range from melanin blocking type medications like hydroquinone or cysteamine. Now hydroquinone needs to be used with caution. Although you can buy it without a prescription over the internet, I don't recommend that you do, because hydroquinone can actually damage the skin if used incorrectly, and it can make pigment worse. Cysteamine is a little bit more gentle, but again you need to use it appropriately, and you need to make sure that you're not ending up sensitizing the skin or making it go back into its inflammatory pathway. There are other products that you can use that can, for example, increase cellular turnover. So it means that you're basically sloughing away the skin cells on the surface quicker, and those skin cells on the surface may contain a lot of pigment. So you're actually ending up removing that pigment in that way. And these products can contain things like retinoids, tretinoin for example. There are also skin brightening ingredients that you can use in products. So things like kojic acid, things like vitamin C, arbutin, and even plant extracts like licorice extract can also be really useful in lightening pigment that's already in the skin. You can also try and reduce that inflammation in the skin by using products that contain things like azelaic acid. So they will also help to reduce that inflammatory pathway that causes more pigment to be produced, and which causes more pigment to be transferred to the surrounding skin cells. So I hope that you found all of that useful. Basically, there are different ways that you can treat post-inflammatory hyperpigmentation. It's not always about clinic treatments. Sometimes you can use products at home that can be really effective, but you have to use them correctly, and you do have to follow the instructions of the person who prescribed them for you. If you'd like to find out more, by all means reach out to me, drop me a message, or book a consultation. I'm always happy to see you.